Problem facing many Americans. Surgery is one way of treating it. Here to discuss is Dr. James Bradley Ray. He's a bariatric surgeon over at Blount Memorial Hospital. Thanks for coming in today.
Thank you, Katie. It's so nice to be here.
Yes. Well, first we're going to talk about some of the risks of obesity because there are things we can do to lower the chance.
Sure. You know, I think it's important to remember that obesity is not just one disease. It encompasses so many things. You know, we're just not designed to carry around as much extra weight as we're seeing. We're not designed to carry around an extra 100 pounds. And it affects literally every organ system in your body, your heart, your lungs, diabetes. Even when you're sleeping, you know, with sleep apnea, it can affect you in a negative way. And
whenever patients come in and they do have some problems with obesity, what are some of their treatment options?
Well, of course, the mainstay is initiating a healthy lifestyle, eating right, exercising. But for many people, that is just not going to be enough to get the kind of sustained weight loss that we need. And that's why surgery has really become a mainstay of treatment. Over the last 5 to 10 years, the sleeve gastrectomy has really moved to the forefront of weight loss surgery. I think that what's been appealing with that procedure is that it's very effective, but it's also very safe. And so it's become the most commonly performed weight loss surgery, not just in the United States, and as well as internationally. And certainly that's true here in East Tennessee.
And if people are going in to ask about this, it's not something that can happen tomorrow.
No, it's not. And I think it's very important to remember, Katie, that obesity is a chronic, lifelong condition, and surgery is not a quick fix. And so things start really from the moment you call in. And we start that educational process, and we're very good at Blount about, you know, offering a comprehensive program to get you through that. But it's the educational process beforehand. The surgery is a tool, and then also the follow-up. So it's a lifelong journey.
All right. Thank you so much for coming in today. We appreciate it.
Thank you so much.
And we're going to